Hi, everyone. It's Dr. Jen. Welcome back to the Integrative Health Podcast with Dr. Jen. Really excited to geek out with you all today with Dr. K. Dr. Pejman Katiraei. He's a board certified pediatrician. He's a proud DO, as we were talking about earlier before this. He completed his undergraduate at UCLA and then obtained his osteopathic medical degree at Western University. He completed a pediatric residency at Loma Linda University, where he stayed as teaching faculty for over 4 years. Dr. K has also completed 2 fellowships in integrative medicine, because one isn't enough, huh? And then has a decade of clinical experience helping children with severe learning and behavioral challenges. He feels that we must do more to help all these children who are struggling, and that's why he helped found Wholistic Minds, an AI holistic assistant to empower an army of healthcare providers to help families treat the root cause of complex health problems. And I met Dr. K through basically a group of physicians and providers that talk about all of the things integrative medicine. So I'm so glad to have connected with him. Welcome, Dr. K.
Thank you. Thank you for having me, and just a pleasure to be here.
Yes, of course. So I would love for you to share your background a little bit with how you were teaching faculty, and then you switched to 2 integrative medicine fellowships, and now you work with a lot of children that really need your help. What switched things for you?
So, I started my integrative training shortly after my residency. So, while I was at Loma Linda as teaching faculty, I was, kind of split between doing some general pediatric, like hospitalist work and things like that, and then, progressively more and more of the integrative medicine. And, over time, what I felt was being in that kind of an academic environment, while I felt that I was making a difference in the minds of a lot of providers, I also felt kind of restricted because you have to be mindful, right? And you can't just do whatever you want in that kind of a setting. And I just reached a place where I felt like, no, I want to do more to help these kids. And I want to push the envelope of what it means to be a healer and to serve. Because I mean, at the end of the day, I'm sure just like with you, there are so many people who are struggling, and for me there's so many kids who are struggling that, as far as I'm concerned, I need to do whatever is possible to help these kids. And this entire journey into, integrative and holistic medicine for me has been searching and finding answers of what causes these kids to struggle, whether it's autism or learning disabilities or, severe anxiety, OCD, depression, sadly, some suicidality, like what drives all of this? And then you can expand it into, autoimmune diseases and so forth. And that kind of root cause kind of pursuit. So that's what really took me more into private practice. And, it's been a learning journey since, for the last, God, 15 years. And I'm still learning. I'm sure that's the case with you, right? If we ever think we're done learning, hopefully that's when our brains have shut off. So yeah.
Right. Right. And I think that we see this a lot with physicians that have came from conventional MD-DO school, is that a lot of the times some of the doctors, unfortunately, they get out of school and residency because they're exhausted. They're just like, okay, that's it. We know the algorithms, we're done learning. And people like us, doctors like us, we still feel that pull that there's more. The body can heal. We need to find the root cause. And, I've said this before, I blame a lot on medical school. It tends to be in the testing, tends to be oriented towards a pharmaceutical, where really it should be more root cause based. So when you were seeing all of these children, you finished your, grueling pediatric residency. Residency is not easy, you guys. It's exhausting. And you started this integrative journey. What led that? Was it because, my journey was people weren't getting better with conventional medicine. I thought like I'd get out of school and help people and they would heal, right? And they were just like standing still. Is that what you saw?
There was definitely that. Kids, I remember vividly, like we had this mental health clinic at Loma Linda, and it was like the worst of the worst, like behavioral,
Mhm.
issues would come. And I remember walking through the clinic, with my supervising physicians, and I mean, they were like several kids that were just completely snowed because the antipsychotics and the multiple medications that they put these kids on, like literally they were just not there. And, there were experiences like that that had me start questioning. And then there was also, multiple experiences where I remember vividly, this beautiful young, I think he was 14-year-old Hispanic guy, loved playing soccer, was playing soccer, fell on the field, got a little cut in his knee, and then 36 hours later, he was dead because of sepsis. And the bacteria got from his cut into his knee, into his bloodstream, into the rest of his body, and he passed away. And, I'm sure you encountered cases like that through your training. And for me, when I would hit these cases, they would be like, oh, the antibiotics failed. That was such an awful loss. That was kind of, the doctors would just shrug their shoulders and say, God, that's too bad. Right. Or I remember there was this beautiful, also like 12, 13-year-old boy, severe colitis. He got this, they call it a toxic megacolon, where the colon just balloons out. They put him on the steroids, put him on the biologic medications, and none of them were working. So they were like, oh, well, the next best option is to cut out his colon. And, like in that moment, my eyes just kind of bulged out of my head for a second. Like, wait a second, this is completely illogical. Like, how are you saying that your pharmaceuticals are the end all and nothing else matters? And because of that, then cutting out this poor 12-year-old's colon for the rest of his life is the next logical answer. And, it was these moments where I just stood back and told myself, well, if you don't have the answers, then someone out there has to have the answers. And that's what led me down the road of, this holistic medical journey. And if nothing else, what I have learned is my patients are the ones who have the most to teach me. Like, I've had some amazing mentors. I love learning from, the groups that you and I met on, right? So there's a constant exchange of information. But what I've also learned to do is trust and learn from my patients. And when one of my patients or multiple patients hit a wall, instead of kind of ho-humming going along with, whatever I was taught, I've learned to stand back and say, okay, well, that was a complete bomb, right? That there's something I clearly don't know to help these children. So what the heck is it that's missing? Let me go find it. And, that's the journey that led me into functional medicine, and then led me into like medical herbology. So the fellowships and things like that. And from there, I got into mold toxicity, and then even got further into mold toxicity and kind of reframing that. And it's all a matter of understanding why certain treatments work really well, and then why are some of my patients still stuck? Because we're here to serve. I'm sure that's why you're here, why you have your podcast, right? We're here to serve, we're here to help. And whatever I can do to do that better is what I feel is my priority.
Yes, absolutely. And that's where mold really came in for my practice, is I'm like, there has to be something else going on, something deeper. And I started testing for it, started finding it, started seeing people get better, and kids too. Like, very interesting stories, like children with chronic belly pain, right? Just chronic belly pain. And mold exposure, did the mold treatment, make sure there wasn't mold in the environment, and the belly pain went away. And unfortunately, sometimes we look at these symptoms and we just treat the symptoms, oh, just give them Tums or give them whatever. No, it's not good enough. Or, I've had patients that, pediatrics especially, they're just told that it's in their head. They have anxiety. The kids are told that, and kids don't usually make up symptoms like that. So mold, why don't you tell us a little bit about mold? Like, why is mold bad?
Uh, so, one of my friends, I think said it best, Dr. Jill Krista. She's, mold is the decomposer of the natural world, right? It decomposes stuff, right? If an animal dies in the forest, molds decompose that. They decompose plants. So they recycle materials. It's just not very good if you're a living human being and that mold is trying to decompose you, right? And when you look at the physiological mechanisms through which mold, and especially the toxins they produce, act, I mean, it's brilliant. They're basically trying to disable the human body to a point where now they can decompose it and recycle it. So they can disrupt the mitochondria. So they disrupt our energy production. They disrupt our gastrointestinal tract in really, really profound, significant ways. They disrupt our immune system. They disrupt our hormonal production. Like if you go system by system by system by system, like these mold and mold toxins are so impressive. I hate to say this, but they're impressively capable at disrupting all of these systems and essentially bringing our, if really bad, bringing our system to kind of a, I don't want to say grinding halt, because then we would not be here, but really debilitating the systems to the point where we start falling apart.
Yeah. And it's very interesting because if you bring up mold to conventional doctors, they will just dismiss it. And I find this bananas because there's so much research on animals and mold and how bad it is. And the farmers, they want to be careful and not feed their crops that are moldy to their livestock, because animals really don't do well with this. And, I don't even know why. I think because it's another root cause kind of thing, but I don't know why we're not focusing on this more. Because like cancer patients, Cleveland Clinic, they tell their cancer patients, you're not allowed to mow the grass because the mold concern. So I think in about what, do you think 20 years, 30 years, this will be more bread and butter medicine? But for now, usually just functional or integrative doctors are who is going to listen to you when you talk about this. Now, what about mold exposure? I mean, so we're exposed to mold all day, right? We eat mold. I guess, could you explain why these acute exposures versus long-term environmental exposures, what the difference is, do you think?
Yeah, absolutely. So the human body was designed to handle a certain toxic load. I mean, we have the liver, we've got the gastrointestinal tract, we have the kidneys, we have the immune system. So we have multiple defense layers that are constantly protecting us against a certain load of toxins. And when it comes to, for instance, a little bit of mold in our food, if our gastrointestinal tracts are healthy, the bacteria in the gastrointestinal tracts actually decompose the mold toxins and basically just cause the mold to pass through. And when you look at certain studies out there that look at the microbiome, everyone has some exposure to mold. But in a healthy system, all that stuff just kind of slides right through us, essentially, and it doesn't impact our system. What's really weird is when someone is living in a moldy environment. So imagine you've got a chain smoker, except that chain smoker is in your wall next to your bed or in your air conditioning unit or in your basement, with the smoke coming up through the floor. So there's smoke, cigarette smoke coming from somewhere. And that chain smoker is constantly smoking with these volatile compounds and particulates kind of being released into your air, except you can't see it. Most people can't smell it. And if that smoke goes on long enough, and remember, this cigarette smoke that's coming from the mold toxins happens to disrupt the mitochondria, the gastrointestinal tract, on and on and on. Studies have shown that when people are in moldy environments, they can inhale it and they have elevations of these mycotoxins in their bloodstream. So all of that is very well defined. What is really troubling is what happens when these mold toxins don't go through the regular route, but instead they're going through our lungs into the blood, and then from the blood getting into our system. So now the protective barriers are no longer there because these mycotoxins essentially went through the back door. One of the studies that I found that was so fascinating is when that happens with the most minute amount of concentration, these mycotoxins can actually start disrupting the gastrointestinal tract. So they can cause leaky gut. They disrupt the tight junction proteins that are basically the glue that keep the intestinal cells glued together. they can trigger an inflammatory response. So they can actually trigger the mast cells, which are one of the main immune cells in the gut that are kind of surveilling everything. So imagine like the army scouts are all of a sudden freaking out because cigarette smoke is being blown, in their face, and that causes them to go completely nuts, which mycotoxins can do. So they disrupt the gut, they disrupt the gut immune response, and through this kind of backdoor, if you want to say entry, they start disrupting the mitochondria, or it's not the mitochondria, the microbiome. So they start disrupting the bacteria within the gastrointestinal tract. And at least what I see in the little kids, so I can't speak for adults, but what I see in the little kids, now that I've been doing this long enough and have watched them, it seems like there's a tipping point where for these kids, the gastrointestinal tract basically just kind of loses it. It loses its integrity, it loses its ability to heal itself. And then the gastrointestinal tract starts falling apart. And then once that happens, you now have inflammation that was kind of localized to the gut now spilling into the entire system. And now the part that I've seen as perhaps even the most troubling thing is we have, trillions of bacteria in our intestines, right? We all know that. These bacteria actually produce their own toxins. They're called bacterial endotoxins or lipopolysaccharides. So they're like these little molecules, if you want to say, that are normally just hanging out within the gut. But when we have this disruption of the gut, now all of those toxins start entering the bloodstream, and they further disrupt the immune system, the mitochondria, the nervous system. They can cause a lot of inflammation within the nervous system and essentially start wreaking havoc. And that's essentially where the house starts, a little tiny fire suddenly causes the entire house to catch on fire. And now your house is burning down and you don't know why.
Yeah, it's scary. And the problem is a lot of these signals that we get, like fatigue, brain fog, GI distress, no one's looking for that root cause. They're just band-aiding all of those. So like you said, that the house is just burnt down, and it's never too late though. That's the good thing. It's interesting because LPS, I keep seeing more research articles on it with mental health, and they can induce, mental health problems or certain things in animals with increased LPS. So I think it's really significant that we pay attention to the gut more. Now, what kind of children are you seeing affected by mold? How are they presenting to you at your pediatric clinic? Because obviously it's going to be different than adults. Kids just do things differently.
Yeah, they do. And, my mentor, Dr. Neil Nathan, he and I have had multiple conversations because the more I've talked to him and watched, what he sees in his patients, I've really come to realize that how kids are affected is actually quite different than adults. So the first thing is you see this fatigue where they just don't have the same vitality as others. And they're the best way to put it is their vitality, that just light that kids emanate, is dimmed. Along with that, a lot of them have sensory issues. So they have sound sensitivity, they've got tactile sensitivity where, clothing, the texture of foods causes them to feel off. Sometimes this presents as social anxiety because, when the children are overwhelmed in crowded environments, we label that as social anxiety. So there's some form of anxiety that comes about, but when you drill down into it, a lot of times that anxiety is actually from these sensory distortions. Some of the children will present with aggression, irritability. They're very short fused. So the slightest thing just causes them to fall apart, whether they start crying and it's like a 30-minute tantrum cry, or they explode in a much more volatile, aggressive way. And, they become destructive. At times, they may not attack other children, but they strongly react to them. And then along with that, we see just this very odd presentation of learning problems. So poor focus, poor concentration, hyperactivity, distractibility, a lot of those things. But beyond that, what's really weird is very specific things like disruptions in short-term memory, disruptions in working memory. So a lot of these kids, what we'll find is they have trouble learning math in particular. Like they're fine with other subjects, but like math is something that's really hard. With the sensory distortions, sometimes there's also visual tracking errors where these kids may be really good in one subject, but also when it comes to reading, they hate reading. And that's just because when their eyes are trying to read the page, it's sometimes they're bouncing up and down. Sometimes that gets mistaken for dyslexia, which is actually more of a central processing of what the information is. So we get this constellation of odd neurological findings from, what could look at like depression to what could look like anxiety. I'm finding that a large percentage of the kids that are labeled as pans and pandas, these poor kids with neuroinflammation, where they just, have odd, intense reactions, actually have mold toxicity. And then, a large population of children who are labeled as autistic, when you kind of take apart, well, why did they get labeled as autistic? Well, they have social anxiety because they have sensory issues. They have, weird fears and phobias, which cause them to kind of struggle in the world. And you kind of pick apart what these labels are ultimately a reflection of. You get to a point where you're like, holy cow, this sure looks a lot like mold toxicity. And it goes back to what you were talking about, kind of understanding the root cause and not just settling at that level of, oh, this is just autism, or, oh, this is just anxiety. It's like, no, what is actually happening in the child to cause them to behave or respond in this way?
Yeah, and it's really frustrating because I found, depending on the parents, obviously they're not, if they're coming to us there for help, but if you try to plant seeds, maybe, a friend's family that kids are labeled autistic, ADHD, all that, you're like, well, maybe we need to do some gut work. Maybe we should look for a root cause. And they're like, nope, this is what they are. They told us this is what it is. And it's just conventional medicine. And this is why I don't like labeling symptoms as a disease. We need to find out, why are you having symptoms? Like I always say, anxiety and depression, it's not a disease, it's a symptom. So digging in a little more.
Yeah.
All of these kids that you're talking about, that you're grouping them more as symptoms instead of diagnosis, which I love. Now, mold can be a root cause, but this disruption of the gut microbiome can, yes, be for mold toxicity, but there could be other reasons too, right? Like other fungal overgrowth, and, Clostridium overgrowth, all of that. Now, have you found a correlation with glyphosate with just making this gut environment even more susceptible to mold? Because I live in, glyphosate capital, not capital, it's just the Midwest. I mean, it's pretty bad where I'm at. And I just feel like these kids are just pushed, their toxic bucket is just way overloaded. And I feel like gut health around here where I'm at in Northwest Ohio, these kids are just exploding with these symptoms.
Yeah. Yeah. I'm grateful that you bring that up, because I've had some families, from, parts of the farming belt, and 100% glyphosates can cause a very similar picture. And when you look at, for instance, glyphosates with mycotoxins, they are disturbingly similar in their physiological, or we should say pathophysiological kind of characteristics. So the damage that they can cause, the harm that they can induce within the human body, they're kind of each other's ugly cousins. And I've had, several families that I worked with where there was no mold, but they are in, they live literally across the street from a industrial farm, and every day or two, those tractors are going by and just wafts of glyphosate. We're not talking like microscopic amounts, right? On, a food that you got that was not organic. We're talking just like waves of glyphosates. And there was one beautiful little boy that was diagnosed with type 1 diabetes, and his gut was just an absolute mess. And initially I was like, oh, this has to be mold. This has to be mold. And we just couldn't piece it together. And then, as we were talking, the mom's like, do you think the farm that we live across has anything to do with it? I'm like, tell me more. And she's like, yeah, like every day there's a tractor going by. I'm like, yeah. And when we checked his glyphosate levels, I mean, it was just off the charts. So
Oh,
any toxin at the end of the day, or combinations of toxins, right? It could be that in certain places, maybe you're not in farm country, but just from the foods that you're eating, those glyphosates are still coming in, and then you add, some mold toxin or whatever else, and that combination is what ultimately derails the system.
yeah. Did they end up moving that family?
Actually, very recently, so this is after 3 years of us working together, they did. And
Good.
and before that, we were just using multiple filters, and they were just being very mindful of mitigating the exposure, and he was doing better, much
Good.
better.
Yeah, because that's what I tell families. People are like, I want more land. I just had this conversation with a friend. Her husband wants more land. And I'm like, well, make sure you're not moving where there's a bunch of farm fields. Like you can't have the glyphosate. The other interesting thing I have seen a lot in my practice, and I'd like you to talk about how having this exposure to mold or previous exposure to mold and having those mycotoxins being produced in the body, um, then they get like a virus, right? Or I've seen this a lot with the pandemic. They've gotten a certain jab, and it, I had an older patient who went from working full time to had to go on disability until we got the mold under control, and then his body was able to heal, right? But what about viruses and mold and how that can make things worse too?
Yeah, yeah. I've had multiple kiddos that had mold exposure, and we got them better. And then whether they got COVID or RSV, and some corona, just regular rhinoviruses, they fell apart again. And I started asking, like, what the hell was it about these viruses that caused them to fall apart? And as I started tracking their symptoms and issues, so with a lot of these kids, their gastrointestinal issues, abdominal pain, what digestive problems started coming back. And as I started digging further and asking, well, how does COVID or RSV or whatever virus affect the gut? And all of a sudden, you find study after study after study looking at how, for instance, just RSV, croup virus, can disrupt the microbiome. It can trigger gut inflammation. It can cause intestinal permeability issues, leaky gut. So I just had this moment of all of a sudden, like, oh my God, if these kids have had gastrointestinal tracts that were super vulnerable, kind of, yeah, vulnerable and fragile to begin with, I got it better, but not completely healed. And now this bulldozer virus rolls up, completely derails the gut again. It would make sense why they have these issues. And as I've started really drilling down into how to get the gut to be more stable, these kids have done better and better and better.
That's amazing. That's really great. And this is not just you fix it once. You kind of brought up that example with that kid. It's not just like, oh, you fix the gut once, it's an 8-week protocol and your kid's great forever. I mean, this is something that you have to continuously like pay attention to, dial into, and that's what that's what we try to teach, right?
Mhm. Yeah, yeah. It's, I mean, I wish it was a quick 2 days to take something and everything is magically better. What I tell our families is, look, we're essentially overhauling your kid's entire system from the ground up. And it's like remodeling the house, except you're going to put a new foundation, you're going to shore up the walls, you're going to put new plumbing, new lighting. We're going to do everything. And part of why that's so important is, in doing it that way, one, the results are astronomically better. I've had kids with regressive autism suddenly make eye contact with their parents and tell them I love you. Kids with horrendous pandas, inflammation, anxiety, where they couldn't go to school, couldn't leave the house. They're now leaving the house, going into the classroom for the first time in their lives, right? Kids with severe gastrointestinal issues now actually able to eat foods. The more important part is when you look at it in that way, it's not just you're treating the symptom in that moment. You're essentially reshaping this child's entire future. For the rest of their lives, their nervous system, immune system, gastrointestinal tracts will be on a healthier course, which means it's not like, here's Ritalin, take it for the rest of your life so that your ADHD symptoms could be better. But, oh, you also have anxiety, so here's a little bit of Zoloft, and you also have this, so here's a little bit of that. We're building everything from the ground up, and in doing so, these constellation of symptoms and issues that may not be seemingly related to someone who doesn't know how to see the correlations all start improving. And by that, I mean kids with recurrent sinus problems and ear infections, but they also have ADHD and learning disabilities. We take care of this. The sinus issues, respiratory issues, et cetera, go away, as do the learning problems and attention issues.
Yeah, absolutely. It's great how when you find the root cause, your body can start to heal if you give it the right tools. So what if there's a parent out there listening and they're like, well, like, how do I even start, right? Like if there's mold in the house, who do I go to find it out? What kind of testing do I do of the house? Because we know that the environment is such an important step, but it's so hard sometimes to figure out how you make that environment healthy.
Yeah, it's a huge problem because I've had so many families that are, suspected maybe there was mold, and what most people do is they go, on Yelp or wherever, and they're like, okay, mold inspector. Oh, this guy has decent reviews. Let me bring them, right? And $600 later, the person comes and looks at your house and says, God, everything looks pretty good. I see one water stain. I don't think it's a big deal. Let me do a test. And they do this very simplistic assessment and come to say, well, there's no mold definitively. And then they walk away, except, first of all, I hate to say this, most of these mold inspectors have zero like actual training in physiology of homes, meaning they took a course, got some certification, they're following a very simplistic protocol. And that simplistic protocol is take one sample from the garden, one sample or two samples from the house. And if garden has more mold than the inside of the house, therefore there's no mold. And when you think about that, you're like, God, that just makes absolutely no sense. And when you further look at things, so a lot of times what these inspectors do is they use these air traps, right? There are these little machines that suck up air, and then they basically trap any mold that's in the air. But you ask the question, well, how far does mold travel? So let's say you've got a window that's leaking, right? And that window happens to be by your kid's bed. And I've had multiple cases where for some weird reason that was where the issue was. How far does that mold spore travel to be able to get into that trap that was set 15 feet away from that window? So I actually, pestered some people until I found the answer. And it turns out that these mold spores travel 4 inches. So on average, unless the air is really disrupted, like someone takes a blower and blows the room and all that dust and air, sediment, most mold spores travel only a few inches from where the contamination is. So if someone is sampling 15 feet away from that contamination, what things are they going to find? Pretty much nothing. And because of all of these issues, we're kind of in this place where the ability for us to assess contamination is like awful. It's not even mediocre, it's awful. There's no standardization in training, there's no standardization in how people test, and everything is all over the place. So part of what I started doing for families is, I like in Los Angeles where I work, I have literally out of all of Southern California, I have one inspector that I trust. And like she's booked out for 3 months. Part of what I've started doing is have families actually test their own homes. And there are these dust tests, they're called ERMIs, where basically if enough dust has settled in your house, you can just take the dust, you go around the house, kind of wipe everything down, And then you send this pad that's now full of dust from your house to a lab, and they use a DNA technology to basically check to see if there's funky mold within that dust. And if there's funky mold in that dust, it says, hey, there's funky mold in your dust. Figure out where it's coming from. One company that I've come to really admire, and I have no financial affiliation with them, but I think they do a really good job and they offer a lot of support, is a company called the Dust Test. And the actual company is called We Inspect. But what's really cool about what they're doing is they're trying to bring standardization and a much higher degree of accuracy to home testing because of this exact problem.
What would be nice is if we had a VOC test, right? Like a home at home kits. So just let's explain why this is how we test. So the dust is actually moist, which not many people like moist, but so the mold likes to live on the dust. And then if there's mold on the dust, then we know that there's mold somewhere, whether it's behind your bathroom, which is pretty common, bathroom drywall, or in the basement from, they didn't disclose that the basement flooded, or if it's in the crawl space, or if it's in the closet, like you said, right next to your bedroom, right next to your kid's bedroom, or if it's in the windowsills because there's not good flashing. A lot of these new houses, they're just putting them up. Or whether it's in the air conditioning vent, dripping down and then collecting mold. Did I miss any common spots? I'm
No, I
just
think you nailed
I'm just
it.
saying, yeah, so people can understand like, well, like, I don't see mold. You might not always see it. Now, I don't know about you. Whenever I go to, it's always in hotel gyms. I'm always like looking up at the ceiling, and it's the drop ceilings, and there's always those water rings, and I'm like, but you do have to realize that we don't want people freaking out over here. Your body is designed to process and detoxify mycotoxins, but it's when it just gets out of control. It's when, you can't juggle 10 balls at once. So something's got to give, right? And I try to tell patients that, and a lot of the mycotoxin tests I ordered, we see some mold, and that's okay. I'd rather see a little bit of citrulline than zero on everything, because then they're just not detoxifying at all. They're keeping everything. So let's get into testing. We have some time still. So let's get into testing. I think we probably use the same testing. What's your favorite way to see if there's mycotoxin testing or mycotoxins being made in the body? And do you like looking at organic acid testing to see if there's colonization or not? And what are your thoughts on that?
Yeah, thanks for bringing that up. So in the kids, and this is specifically kids, I'm pretty convinced it's different for adults. What I found over the last, I've been at this for about 6 years, is the urine mycotoxins are not always reliable. And I've had many, many kids who are highly toxic. Like they were living in a home where it was so bad that the inspector, like run-of-the-mill inspector, we're not talking fancy holistic, run-of-the-mill inspector comes, does the testing, and says, you need to leave this house because the contamination is so bad that it's like a health hazard.
Wow.
I've had cases where that level of exposure and contamination, urine testing looked normal, specifically because of what you were talking about, where it really seems that these poor little kiddos just lose the ability to push the toxins out into their urine for the test to show up. So over time, I actually started using those tests less and less, because there were many a times I would look at them and say, I don't know if this is scary exposure or is this kid just having a little bit of toxins and nothing is bad. The urine organic acids that you brought up. So basically, these tests check for biochemical compounds in our bodies, and they look for levels of certain biochemical compounds that should not be there if everything is healthy. And it turns out that, molds like aspergillus and other fungi create their own biochemical compounds. And when these molds are potentially higher in our gastrointestinal tract or wherever, they're now, having a block party, and they're having lots of fun, and they're releasing their own compounds into our body, which gets into the urine, which gets detected. I find those tests to be very useful. I find their sensitivity as the initial assessing kind of test to be very poor. Like I'd say maybe 50% accuracy in terms of picking, so sensitivity, picking up mold toxin exposure or colonization or toxicity. So 1 out of 2 times, test looks normal, kid has still been badly affected. So what I have started using is actually antibody testing. So this is, we draw blood, sadly, we have to poke the kid, but we basically check them for immune reactions against the molds, or there's another company that would actually check immune reactions against the mold toxins. And at least in the kids, what I have found is the sensitivity of these tests is much better. Not 100%. None of the tests are 100%. But I'd say 70, 80% of the time when there is exposure and toxicity, these antibody levels go up sufficiently to say, oh gosh, like the immune system has seen mold somewhere. Where it is, when was it, like that's a different story, but we can say, God, yep, mold has been part of this picture. So that's how I approach the kids. I know for adults, again, it's different, but at least for the little kids, I found this to be the best way to pick up if they've been exposed.
Yeah, that was a great explanation. And what we also have to understand is these tests aren't perfect. And if we have the gestalt, if we think that it's a toxin, a mold problem, or it was, or something, there's some exposure, we need to act on that or talk about it. And you were giving the example earlier how your patient brought up the farm field across the street. I mean, our patients' parents, they're very smart. And if you just sit there and listen to them, they're usually going to tell you what's going on, or maybe a few prompting questions. And then they'll be like, oh my goodness. And it's happened for me with patients. They'll fill out the intake form about, I'll ask questions about mold or amalgams or Lyme, and they'll say no for everything. And I'll be like, oh, are you sure? And they'll be like, yeah. Then they'll come back the next visit and they'll be like, you know what? I was talking about this with so-and-so, and I lived in a moldy dorm. We were sure it had mold in it. And then you put those pieces together. So this, this isn't perfect, right? This isn't a perfect science yet. Tests, even conventional testing isn't perfect. We know that. So a lot of the times too, just focusing on rebuilding that gut. I'm sure, do you sometimes just, I don't know what's going on, but I know we're going to start with gut health kind of thing?
Um, so there have been times where it hasn't been clear. Um, but I think one of the things that I've learned to do over time is just based on how the child is presenting to have a decent sense of what's what. And this is part of what I've been trying to share, with the medical community, because I think the biggest, honestly, limitation in our current practice of mold medicine is our diagnostic testing. I mean, frankly, is awful. The rates of false positives or false negatives, especially the false negatives, I think are way too high. And it creates a space where there's some guessing that providers have to do until they get to a place where, one, they start understanding the presentation and mold toxicity. So if you do it long enough, the presentation becomes more obvious to you. And I think if we have enough honest conversations about like what are the limitations of the testing in different populations, and say, you know what, this test fails 30% of the time or 50% of the time. So you as a practitioner should not solely rely on this given test, like an organic acid test, because I mean, 6, 7 years ago, I was using organic tests as my only way of assessing mold. And my mentor, Dr. Nathan, is like, hey, Pejman, by the way, do you notice that test doesn't always work? And that's when I'm like, oh, yeah, you're right. Thanks. But if we have these, open and honest discussions, rather than saying, oh, this is the best test all the time, which is, what most communities do, I think we can start making more headway. And I, for one, what I try to teach, those that I work with, the providers, is try to, if you can draw blood, do the antibody tests, and then do some kind of urine test on top of it. And now you've got two different ways of assessing the problem. And either both of them come back looking totally normal, in which case then it's like, okay, was this Is this glyphosates? Is this Lyme or, other Lyme co-infections, heavy metals? Now you go down these other rabbit holes. Or, oh, shoot, one of these two tests came back, with an obvious problem, which then helps you confirm like the mold, toxicity is playing a part.
Love it.
Mhm.
That's so great. And I have a silly question for you as we wrap up. Would you rather eat regular peanut butter or organic, and why? Since we're talking about mycotoxins.
So my holistic brain would say organic, but as I'm sure where you're headed, unfortunately, organic peanut butter has such scary high amounts of mold toxins that you're better off just not eating it. And
Oh,
to your point, there was one or two times where the families did a urine test, and the levels came back like so scary high to the point where the mom's like, "Oh my God, I'm gonna die." And then I'm like, "Okay, tell me what you're eating." She's like, "Well, I have some peanuts and, on and on." I'm like, "Well, half those foods have mold in them. Why don't you just cut them out?" And she cut them out, and we retested a month later, and literally the levels went from, "Oh my God, I'm going to die," to, "Oh my God, they're not there." So,
right.
yes, some of these organic foods like peanut butter have, because there's no pesticide to prevent the mold from growing on it, are chock full of these toxins.
Yeah, so I take a little bit a different viewpoint on that
Okay.
because I think our bodies can break down aflatoxin, right? So I would rather eat organic because I know my body can break down the mycotoxins versus a pesticide, which is abnormal. Like my body's going to struggle more breaking it down. But I don't know. We get Valencia peanuts and they're supposed to have lower mycotoxins, but who knows, right? This is where sometimes I should just be like, should I just eat steak all day and ground meat? But it's hard. But this is not to create fear. We're just having fun with this because your body your body can handle toxins, right? It's just and your kids' bodies can handle toxins, but we live in a different world. Like when we were growing up, the toxins were not as much. I mean, that it's just out of control now how many toxins there are. So just do a little bit by little bit every day and keep learning. I
Yeah.
tell the parents out there.
And I think the most important part, and you alluded to this, but I think it's worth stating again. The most important part of this conversation is just the profound degree of healing that's possible by using this approach. For a lot of parents, there are certain things like you just presume that your child just has some learning disabilities, and she's just not very good with math, or she's not very good with reading, or he's just temperamental, or there's so many things that we just come to normalize because in our conventional practice of medicine, like every kid has some ADHD or learning disability or whatever, right? And when you step back and you say, well, who is this child or person really? And what are all the things that are mucking up their ability to shine in this world? As you take that approach, the most beautiful thing is suddenly a different version of that human being starts showing up, where the child that was flunking, school because they couldn't focus, they couldn't learn, they couldn't process, is now like literally the top student in the entire school, and their grades are just shot through the roof. The kids who couldn't manage their emotions and were getting into fights, getting into trouble, about to get kicked out of the school, is now the model student who is making friends left and right and is able to emotionally and socially connect in profound ways. Kids, and I know you've had the same experience. Kids who are getting sick left and right, ear infection, pneumonia, sinus infection, are now the kids who don't get sick at all. And I'm sharing this because if we can get to a place where we can really look at this not as doom and gloom and, oh my God, this is the end of the world, but oh gosh, there are so many answers that once we find them and we put those answers to work to figure out how to solve whatever is driving the problems, we can get rid of so much disease and disability and struggle and allow so many people to have such healthier and vibrant and just better lives. And I know that's why you're having this podcast and why you're sharing this information, and frankly, why I was so happy to join you.
Yes, of course. And we, as parents, we have to fight for it. As physicians, we need to fight for this information to get out there because honestly, it doesn't really make anyone money having healthy kids and healthy adults. So that's something that, share this podcast because it does matter. And we definitely can change health around for our kids. Kids are sick right now. How do our parents listening, or grandparents or whoever listening and this resonates with them, they need help, they feel stuck. How can they work with you, Dr. K? And where do you hang out on social media?
Uh, Thank you for asking this. So, my social media, I'm primarily on Instagram, and the handle is Holistic Kids with a W. So WHOLISTIC, and then Kids, KIDS. My clinic is under Holistic Kids. So if you just type that name into the website, it comes up. My biggest focus and passion is really to do more to help empower providers, because me seeing patients in the clinic, as much as I love my patients and love my practice, I think, as you alluded to, there's too many people who are sick. There's too many people who are struggling. And, part of what I see as my main mission is to empower more providers to comfortably access this kind of information and put it to work. And part of what we did is build Holistic Minds. So same WHOLISTIC and then MINDS. And Holistic Minds is really a portal to help providers see these things more easily, because sometimes it's hard to know, like, is this really mold? And then if it is, like, which of these friggin' tests do I order? What do these tests mean? How do I handle the detoxification and treatment? I don't have 5 years to go train, right? I think that's the biggest challenge. There's so many good providers out there that want to help. There's so many providers, physicians, nurse practitioners, health coaches that want to do good, but they don't have time to sit there and train for years upon years. They want to just work and help people. So part of what we're trying to do with Holistic Minds is really fill in that gap and essentially give whoever that's interested superpowers so they can see things more easily, treat them more effectively, and at the end of the day get results more efficiently. So that's part of our goal and mission, to just through that help hopefully change the world and bring a lot more health for all of those who need it.
Yes, I love it. It's such a good mission and you have such a good passion. I know in our group, you do all you can to educate other practitioners and providers just to really, like you said, get the word out, start getting the work done, start changing lives. I will list all those websites in the show notes for everyone so they can connect with Dr. K, whether you're a patient, soon to be patient, or a provider. Let's change things. Let's talk about this, talk about it at the grocery store, at baseball games. Let's normalize health over prescription meds and band-aiding symptoms. So thank you so much
Hallelujah.
for being here. I know your time is so valuable. We really appreciate it.
Thank you for holding this space for us to get this information out there.